Hi, welcome to Detours Understanding Acquired Brain Injury. And with us, we have Jenny. You haven't seen her in a bit, but you remember from the intro video. And so we're going to be talking about. Hi, welcome to Detours Understanding Acquired Brain Injury. With us, we have Jenny, as you can see. We haven't seen her in a little while, but you remember her from the intro. And so we're going to be talking about something really important, but most people don't think about that with acquired brain injury. That is dental health. Jenny, can you just tell a little bit about, well, basically what affected you for the last year?
So my teeth have been breaking off at the gum line over the last year. I've had to have them all removed between 1 and 4 at a time. As a result of dry mouth, I developed an infection that got in under my tooth and into one of my teeth cavities and turned the inside of my teeth kind of like chewing gum. And then they weakened, obviously, and they started just snapping off for no reason. And so at this moment, I have no teeth. It's not been fun. It's been extremely painful. It's been caused by an infection that has neither been able to be identified or cured, which is why we took them out a bit at a time. If we'd realised it was just going to go through all the teeth, we would have taken them all at once, and I would have teeth already. It also ate into the bone, so that affects what answers we can have, like what I can have. Can I have, implants, dentures? Can I have some of each? Can I, So it will be over a year that this has been happening. And on Friday the 9th, we begin the reconstruction process. But I have a list now that I've never had in my life. You see, my face has fallen in, my lips have fallen in. I can't obviously eat anything like, hard food, real food. Boy, am I sick of mashed salmon and fish.
Yeah,
I thought I would never say that. I love salmon. I could eat salmon every day, I thought. Apparently I can't.
Well, mashed is certainly not a good way to have it either. Part of it is the
No,
texture.
with mash on the side, but still.
Okay. Yeah.
Because I can't eat a cooked carrot.
Right.
You can't gum a cooked carrot.
Yeah,
it doesn't go anywhere.
Right.
It's got to be so soggy. This is the problem. Keeping your nutrients up while you're actually losing your teeth.
Right.
Being able to eat enough of a varied diet is really hard to do. Yes. So
and this takes us to like what we want to talk about to understand it with acquired brain injury. Oh, by the way, you almost went septic a couple of times too. You almost had septicemia.
I did. Yes, I did. Definitely.
I know you were admitted to the hospital.
Twice. Yep. Twice I was, definitely.
Yeah, because I remember when we talked, you were so sick. I mean, you looked toxic as heck. You looked practically green.
I hadn't seen myself until I talked to you on the phone like we do.
Yeah.
And I looked at myself and thought, wow.
Yeah. I mean, you were.
I should go to the hospital.
Yeah. I mean, you were toxic as heck. And so this actually, it's like, so what is it that goes on? And so basically, with brain injury, and not just traumatic, but other forms of acquired brain injury, one of the things is now we have cranial nerve that controls the secretion of saliva. I'll put up the
dry mouth.
And it controls that secretion. If that facial nerve is damaged, we don't produce saliva, or if it's injured, not enough to help us And we need the saliva for not only for softening food, we need it to wash out the food from our teeth. Obviously,
And
then that
I got
affects.
dry mouth, which is where the infection came from.
Mhm.
So I was doing what would be called a dental routine. I'd clean my teeth morning and night. I'd
Sure.
mouthwash them. I'd floss them occasionally. I can't say I had wonderful dental hygiene, but I certainly had dental hygiene, and it was every day.
And the
Um,
and the thing is, like without that saliva, eventually we get cavities, and it causes teeth to fracture because if we don't maintain, and this is why regular dental visits are important, but it does more than that with brain injury. We also can lose our sense of smell and taste. We can have problems with which then, so where we have problems with like with what we eat. So we may eat things that have stronger flavors, or we may eat things that are crunchy, give us textures, which changes the stressors on the teeth, increases likelihood of fracture, and with dry mouth, which, by the way, medication can add to. Certain meds will dry out your mouth, certain psych meds, as well as certain neuromeds, anticonvulsants, stuff like that.
and
Also,
your opiates and your
yeah, pain
painkillers,
control, which is yet
what was
something
all of
else.
mine. Mm.
Also, with brain injury, our ability to sense pain is changed. We may be
Mm.
more or less sensitive in different ways. And so, if you have a cavity, you may not notice it and it may be let go. And so, then it comes to the point where teeth fracture off because you don't feel the pain, or you may be on your way to becoming septic and you don't know it until it is too late. And then you end up being very sick.
My first tooth that went was one of the front two at the middle. So front two, middle, bottom.
Mm,
And I was at dinner with friends. I knew there was something weird with that tooth, and I was going to get it, I was going to get it checked.
right.
Next time I went, a dental thing, I didn't feel like it was urgent. And then out for dinner with friends, had something with chicken, had a bone in it, crunched on bone, end of tooth. And that was the beginning of the end. And they went like,
Yeah.
there were times I had one tooth at the top that was just ridiculous
Right.
that no one would take out, like because of the infection.
Also, our calcium can be affected because the pituitary, if you have brain injury, traumatic brain injury, but other forms too, it changes the secretion of calcitonin, and therefore your teeth may be demineralized. So your body may be pulling because it's not getting the right calcium signaling. It may pull calcium, thinking you're low in calcium. It may pull calcium from your teeth because it doesn't know that your calcium's okay. So it may literally be pulling, so your teeth are weak and more likely to break. This is something that comes with brain injury too. Another reason to see a dentist regularly.
Mm-hmm.
Sure you are seeing because your teeth are weaker. And also, they lose the innervation, they lose the nerve signaling, which controls circulation to the teeth individually. And so, again, the pulp may die out. This is where you're talking about pulp being kind of gummy. If they're not
Mm.
getting the right signaling, their circulation goes bad. And if the circulation goes bad, the tooth dies. And so you end
And
up,
my sleeping circulation did definitely go bad, didn't it? It really went
yeah.
awful.
And so basically, the tooth that died inside, the
Mm.
living part of the tooth dies. And so it's just kind of like a hollow, and that increases the likelihood of fracture and makes you more vulnerable to infection from the dead matter inside.
Yes. Yep.
Yeah. So, and there are other factors too. We have trouble fighting infections more than folk do. So we get sick a lot easier, and that also attacks your teeth. There are tons of different forces. We have a higher rate of TMJ, and we grind our teeth more.
I
We're
am a
older.
I am a from way back teeth clencher, but obviously post brain injury, I clenched my teeth a lot more.
Right.
And I had seizures, which also meant I clenched my teeth.
There's another seizures. You clamp down hard, and if you have these other factors, it increases your risk. I mean, this is why not only making sure you brush your teeth and other things like this regularly, but also making sure you see your dentist and making sure you have, I should talk. I need to be more faithful to that, but it's like the other problem is we're more sensitive to pain.
We
misinterpret it.
I have been told now by my dentist, I actually have a really good dentist now, that things like Listerine sheets. I don't know if you know, do you get Listerine sheets?
We have them.
After you've had your medication, whatever medication it is, have one. Or use mouthwash or clean your teeth. You need to actually stimulate your teeth to be wet, your mouth to be wet.
Yeah.
And don't let your mouth dry out, because it really can be the beginning of the end.
Yeah, that's a good point. And I do struggle with dryness. That's a very good point.
Whatever the infection is, you don't want it. No one wants that infection, I assure you.
There are many problems. There are a lot of different oral infections, and finding a dentist that knows about the risks associated with brain injury is, well, good luck.
Yeah. And he was extremely concerned because my injury goes down my neck as well. He was extremely concerned that we'd get to take all my teeth out and I'd still have the pain, because the pain was actually being referred from my neck. Luckily, this hasn't happened, but it's been a concern of his the entire time we've been doing this, that he's been taking out my teeth and they're actually still going to be as sore as, as they are when they were at their sorest, when they were septic.
Yeah.
That would be a terrifying thought.
Yeah, and that relates to our discussion about pain signaling and problems with processing that. So there are sedation dentists. There are those who will put you back. It's like, but you need to find somebody who can deal with and who knows safely how to anesthetize. A provider, an anesthesia provider who understands brain injury safely, because giving us anesthesia could be a challenge sometimes. It's like they have to know about your history, stuff like that, to give us slightly lower doses and, modify and choose the right medications for a person with brain injury, because, but they also have to know the risks that come with it. So
that's right. Yeah.
Is there
he
any
was more concerned about me coughing when he's drilling the little things in. He's like, don't cough. If they go in your lungs, you must have an operation. I'm like, I don't want an operation.
Really,
not like one of those operations. Do not cough. So
it would be
if there was anything
the kind of thing where they should probably knock you out to do.
Well, yeah, but you'd have to go to hospital then.
Yeah. No. But I'm saying that if they're going to put something in that's that delicate, then maybe they should anesthetize you to do it. If they have to give you instructions like that, maybe you should be,
maybe. Yes. It won't be being fun, I can imagine, at all, actually. I imagine being extremely painful afterwards as well, which will screw with all my pain meds and everything. Anyway, but look, there's one piece of advice I'd give to anyone with a brain injury taking any sort of tablets or medications, whatever.
Even not taking it.
Get to your dentist regularly. Go every 6 months, even if it's a 12-monthly checkup. Just go. Get that cavity fixed straight away. don't put things off, because putting things off caused mine to be a lot worse than it could have been. And be responsible for your own oral hygiene, even if it's just carrying a box of those little, mouthwash things, and take them after you've had your tablets. If you take 6 lots of tablets a day, have one of those 6 times a day, at least.
Definitely.
Really, your teeth are important, and when you lose them, you realize how important they actually are and what a hard struggle is to get them back properly, and costly.
It is important to stress that, it's like acquired brain injury can mess with your dental health. And if you have problems with dental health, it can affect your own well-being. It can affect your diet, can affect, it can cause infections. It's a two-way kind of connection there. And so it is essential to understand. All right. And so it's good to have you back again. It's like I was concerned about your well-being quite a bit.
Actually come back. Honestly,
yeah, I know. I was concerned.
I had an extremely sick year.
Yeah.
And there was very few times that I went to hospital and thought I might not come out.
I did think that when you were toxic like that, because we talked about septicemia and how deadly septic. And so I have a few videos where we talked about how dangerous being septic is. So.
And how close I was.
Yeah, you were not in good shape. I was not happy those 2 times.
No, definitely not. Okay, it's been lovely being back, and you'll see me again soon.
Yep, and so please, if you have any questions, concerns, anything that you'd like to add, please click like, subscribe, please, and put them below. Any questions for Jenny from me? And you know how this works. Please share with anyone you feel may benefit from the information we have here. And we'll see you again. Bye.
Bye.